So your doctor tells you that you have arthritis in your knees, and your friends are talking about different treatments with you, and one of them mentions platelet-rich plasma, or PRP. Well, how good is that treatment supposed to be compared to steroid or gel injections? And how long is it supposed to last? We'll talk about that right now. Hi, I'm Dr. Leon Scott, one of the sports medicine specialists with Vanderbilt Orthopedics, and also specialize in non-surgical treatments of osteoarthritis, especially of the hip and knees. And one of the treatments that we offer here in our Spring Hill, Tennessee office is PRP, or platelet-rich plasma. Classically, we've treated people with steroid injections. You may have seen these before. We've also used in the past hyaluronic acid injections. These are injections made of a material that looks like and mimics some of the material in cartilage. But in the past few years, sports medicine doctors and orthopedic specialists have been moving towards tools like the one represented here called platelet-rich plasma, where we take blood from your body and then we take a preparation of that blood and inject it back into a joint. The parts that we inject back, we believe, have a significant amount of anti-inflammatory properties. So how good is it? Especially since it's not covered by insurance. Well, let's go over the benefits by comparing the three treatments head to head. What amount of benefit do people see with this? Well, if you look at everything on a 10-point scale, where it's a measure of what percentage of normal you feel that joint, your knee or hip, is compared to when it's been at its best, we typically see that steroid can get you about 2.5 points back on that functional scale. So if you said my knee is always a 6 out of 10 in terms of pain, it's 60% as functional as it's been in the past, you would expect to see it improve to about a 3.5. What about viscosupplementation? Well, unfortunately, it's usually between 1 and 1.5 points of benefit, which is also the same amount of benefit the general population needs to see in order to actually be able to discern if there's a change at all. So many people don't notice any difference, and other people notice only a modest difference. What about PRP? What we see is that individuals tend to get between a 2 to a 3.5 point improvement in function and pain. So that 6 out of 10 pain may go down to a 4, but it may also go down as low as a 2.5, which is more effective than steroid in some individuals. But for how long? How long do you expect to see those benefits? Hey, let's take a look at another visual. This one is going to be a chart or a graph, and what we're going to look at is benefit. So we'll mark this up to 4 points, 2 points there, and over time. So if we make this 1 year, 6 months, and 3 months, what we see is that with steroid, what you get is a big burst that peaks in about the first 2.5 weeks. And then it slowly tapers down, where some people will experience the benefit out until 3 months. Viscosupplementation, the gel injections, it's often a more modest increase over the course of a month, and then it holds, sometimes tapering at 6 months to a year. So somewhere in the middle there. How about PRP? Well, what we see is that in that first month after the 3 injections are complete, the individuals can get up to a 3.5 point improvement, and it lasts for up to a year and perhaps longer. I'm really interested in making sure that we know exactly how much benefit people continue to see as more and more people start to use this tool. So in our office, we actually have you fill out a questionnaire that allows us to measure your function in comparison to other people who've had these treatments so that we can get better information over time. One of the tools that I have patients use at home so they can track benefits for themselves for these type of treatments and other treatments is an app called the MedJournal Logger app. If you have an Android phone, you can download it from the Google Play Store. If you have an iPhone, unfortunately, I'm still working on the update for the app there, but each day you can just track what you've been doing and the benefits that you're seeing, if it's been a good day or a bad day. And hopefully over time, this type of tool will help replace paper questionnaires to make it a little easier for you to really track and report back to us how much benefit you're seeing. If you have other questions about treatments for osteoarthritis beyond injectables like oral medicines, physical therapy, braces, even the use of nutrition and diet to effectively address your osteoarthritis, I'd love if you gave us a call. I'll link the number or show the number around here for our office. Again, we're in Spring Hill, Tennessee. But of course, you can always leave a question or comment below. Click on some of the other videos that I'm going to have popping up around my head that talk about other treatment tools to treat other sports medicine issues. All right, everyone. Thanks for watching.